My name is Suzanne Greer. I've been a nurse for 38 years now, and 22 of which have been at Gwinnett Medical Center.
My name is Michelle Kubiak. I've been a nurse for 16 years, all of which have been here at Gwinnett Medical Center.
My name is Amanda Williams. I work over in Duluth on the intermediate ICU unit. I have been a nurse for 9 years, and I've been at GMC for 7.
I'm Jordan Bliss. I'm a nurse here up on 6 North, the Center for Neuroscience.
My name is Maite Martin, and I've been a neonatal intensive care nurse for about 12 years, and I've been at Gwinnett Medical Center my whole entire career.
So what motivates me to care for my patients at the bedside is my patients themselves. I consider it an honor and a privilege to be able to care for people during their most challenging and vulnerable times.
My patients are the ones who keep me motivated to stay at the bedside. Bedside nursing is really all I know.
It gives me great satisfaction to help all the patients, the nurses, and the patients' families who need me in a time of crisis.
My grandfather actually passed away from prostate cancer, and to see the care that he got and how loving the nurses were just kind of motivated me to be a nurse.
Well, I feel like nursing is my passion, and being at the bedside, it gives me the opportunity to help people, and that's what I do best. The Nurse Advancement Program is a program designed for nurses at the bedside. It is a challenging program which prompts you to try your best and set your limits higher and participate in activities that you never thought of. To me, it was motivation for obtaining my certification and precept nursing students and residents, as well as teaching classes that I never thought I could.
So one of the big motivating factors for me to join the Nurse Advancement Program was knowing that the work that I was going to do through Nurse Advancement was going to directly have a positive impact on my patients. So whether I was at a health fair educating patients about stroke prevention, or if I was auditing patient charts to prevent ventilator-associated pneumonia. I know that all of those things are important, and ultimately those are the things that are going to improve the care of our patients, which is the goal.
The NICU Preemie Party is a preemie party that they put on every year for the preemies who have graduated from the NICU. I didn't initiate the NICU Preemie Party, but being a part of it and help setting up and being with my coworkers and my friends there, I thought that was a really great thing. It felt really accomplished.
Well, I've tried to develop projects that reflect the work I do in the hospital. And one of my responsibilities is the Resuscitation Review Council. So 2 years ago I developed the CPR Challenge to promote improvement in compressions and get the code teams organized.
The unit council, and got that started back going, and now it's continuing, and so that's really what I'm proud of, is that we got a more involved unit council on our unit.
I think as we do educational things, I think those things are good for our unit. The more we learn outside of just our day-to-day taking care of patients, I think that has a great impact on our unit.
Working in ICU, I know that I can make a difference in people's lives, both at end-of-life care and staying with the family and comfort the family and being there for the patient, and helping them recover from whatever critical illness they may have at the time.
This program allows everybody, it gives a fair opportunity to everybody to contribute to the unit as a whole. It's divided in different pillars, so everybody can pick whatever they feel comfortable with, and they can develop projects based on their comfort level.
We have some really great nurses here at Gwinnett Medical Center, a lot of whom are already very plugged in and involved in their unit. So I know for me, there were some things that I was already doing that would gain me points. It's also encouraging to know that unit managers, clinicians, and the NAP committee. They're all very supportive, and they provide a lot of opportunities for points so that you don't have any problem trying to find how to make that happen.
I think this kind of exposure will show nurses what a benefit it is. If they're willing to put some extra time in or look at their what they do for their unit, they may be doing projects that would be helpful toward their NAP points that they don't realize they could get credit for.
There is some time commitment outside of work, but at the end, when you get your little award and you're recognized in front of all these other people that have put in the work with you, it's worth it.
Anytime you're a part of something, I think it helps the development of the unit. So encouraging even the younger nurses, the newer nurses to come in and advance their career. It's a way to get to know people. It's a great way to make friends. It's a great way to have relationships just outside of the hospital with people who are like-minded like you.
To know that I can make a difference in somebody's lives.
I like to push myself, I always have, and I like to take others with me if they're willing to come.
Every day that we as nurses come into work, we're given a huge opportunity to be able to make an impact on patients and their family members as well.
Continuing to grow professionally, I want to be the best I can be.
It's camaraderie, really. It was a great being a part of something.